Good morning, friends of the media. Thank you for coming to the 11 a.m. anti-epidemic press conference today. Apart from the Chief Executive, we have the Secretary for Food and Health, the Chief Executive of the Hospital Authority, Professor Ivan Ho, and Professor David Hui. In a moment, the Chief Executive and the other panelists will first say a few words, and then they will take questions from the floor. In the light of the epidemic, please wear your mask and keep the distance. First, I'll invite the Chief Executive to speak. Friends of the media, members of the public, good morning. Together with the Secretary for Food and Health, the Chief Executive of the Hospital Authority, Professor David Hui and Professor Ivan Hong, I'm here to give you an account on the treatment of COVID-19 patients. Here, first of all, I would like to express our care and concern to the Shenzhen municipal government and the people of Shenzhen. We learned that in the light of the epidemic, from today, the 14th of March to the 20th of March, the Shenzhen will be conducting 3 rounds of PCR tests across the whole city of Shenzhen. All working units are asked to work from home and to stop any non-essential activities. Under the leadership of the Shenzhen municipal government, I'm sure they will be able to handle the epidemic well. Now, also, I'd like to say this to the people of Hong Kong. Now, since the start of the 5th wave of the epidemic, the Guangdong provincial government and the Shenzhen municipal governments have rendered us some staunch support, and they have done much for us, and we are very much grateful. Now, Shenzhen municipal government is now, has been preparing for these 3 rounds of PCR tests across the city over the weekend. Still, they kept up liaison with us. And we learned from the Shenzhen municipal government that they will continue to ensure supplies to Hong Kong. So I said that they're going to work from home, but then the only exception is for businesses that will ensure supplies to Hong Kong. And starting from midnight today, they want to make sure that there is no disruption to supplies to Hong Kong. So the 2 governments have started the operation of a number of cargo transfer points at different boundary crossing points. That is the Shenzhen Huanggang BCP, Mankamto BCP, Lentian BCP, and Shenzhen Bay BCP. So there are transfer points for cross-boundary drivers at these various BCPs. This is to make sure that we could continue to get supplies from the mainland. At the same time, we want to prevent the spread of the disease. So here, I would like to express my gratitude to the Shenzhen municipal government for us. Now we are talking about treatment today, so I will, give the floor to the experts in a moment. But then, of course, as we know, our top priority now is to reduce the number of severe cases and death cases, as well as to reduce infections. In the past week, the hospital authority has done much to enhance their treatment capacity. In a moment, Dr. Tony Ko will tell you more. In particular, the conversion of the Queen Elizabeth Hospital to designated COVID-19 hospital, and also the conversion of beds in other hospitals to beds for COVID-19 patients. Here, he will say more in a moment. And now I'd like to make an announcement on 2 issues. One, last week I mentioned that with the help of the SL government, the hospital authority has managed to procure relatively sufficient quantities of 2 oral medication that's effective for treating COVID-19. That is the Monopiravir of MSD and Paxlovid of Pfizer. For Monopiravir, the medication is derived in Hong Kong and is being used. Dr. Tony will tell you about the efficacy of the medication. As for Paxlovid, the first batch will arrive at Hong Kong today. That is the Pfizer oral medication, Paxlovid. It will arrive at Hong Kong today. As for other batches that we've ordered, they will arrive at Hong Kong in the next 3 months. So with the full cooperation of the pharmaceutical companies, the SL government and the hospital authority have successfully procured these medications, and they will be arriving in Hong Kong. In a moment, the two professors will explain the application and the efficacy of these two medications to you. Second thing I'd like to announce is that last week I mentioned we want to enhance the treatment capacity of the hospital authority. So I have put forward a request to the mainland authorities. We asked the central authority to send medical teams to Hong Kong to support our treatment work. Last week, a team of 16 came from Guangdong to Hong Kong to conduct visits and also to have discussion with the hospital authority. They also visited the community isolation facilities managed by the hospital authority at the AWE and also the Land Child Hospital Hong Kong Infection Control Center. They have now made preparations. I've just learned that the mainland will be sending medical teams in batches to Hong Kong to help with the treatment of COVID patients. The first team of 75 will arrive at Hong Kong later today. And in this week, there will be another 300 medical personnel coming to Hong Kong to join in the treatment of COVID patients. There will be more batches of healthcare workers coming from the mainland to Hong Kong, and that will enhance the treatment capacity of the hospital authority. In a moment, Dr. Tony Ko, the hospital authority chief executive, will explain to you their discussion and arrangement with the medical team that was here and on the deployment of medical personnel. Now, I would like to thank the central authorities again. In the past few months, definitely they have met all our requests. And then now there were mainland teams who came to conduct visits and inspections, and then they tried their very best to provide us with medical and health workers to make sure we could reduce severe and death cases. Here, I would like to take this opportunity again to thank all groups and individuals for helping to treat COVID patients. Of course, I must thank all frontline staff of the hospital authority and other medical personnel. They've been working under immense pressure day and night. I would also like to thank local and mainland experts for giving very important expert advice on the treatment of COVID patients. That includes the two professors here. You know them well. You've interviewed them often too. That's Professor David Ho and Professor Ivan Ho. I would also like to thank the teams of the Fire Services Department and as well as others involved in transferring patients, because we have designated QH as a COVID hospital, so that involves massive transfer of patients. Fourthly, there are various medical organizations, the two medical schools and the pharmacist sector and so on. They've all supported our work. They also offer treatment advice to the public. And fifthly, the two pharmaceutical companies that I mentioned, we have this severe wave of epidemic, and they are giving us full support. So they are advancing the delivery of oral pills for the treatment of COVID patients. Finally, I would like to thank family members of the infected. We are in a very difficult time, but everyone is being understanding and cooperative. Now, I would like to invite Dr. Tony Ko to tell you more about the work that I mentioned just now, and then later on the two professors will talk to you about the application and the treatment using the oral medication. Thank you.
Dr. Ko, thank you, C. Good morning. I would like to report to you the work of the HA. Now, our focus is, of course, to reduce fatality, to reduce serious cases, and to reduce infection. As for treatment, as mentioned by the Chief Executive, we have already introduced Molnupiravir for MSD for administering on patients. Very soon, we're going to start using Paxlovid from Pfizer. Our treatment will be multi-pronged for inpatients, for instance, for inpatient cases and also confirmed cases from care homes, elderly care homes who will prescribe these two drugs. And we've started to prescribe these drugs at our designated clinics so that people can also receive treatment at these clinics. The professors will mention that the indicated patients are those with higher risk, such as senior citizens, unvaccinated, and even without symptoms. They are suggested to make appointments at designated clinics for treatment. So the number of designated clinics will start to increase from 17 to 23 tomorrow. As for the number of slots, we will increase the 3,000 to 4,300 slots so that those who urgently need treatment can get an appointment. As I mentioned, for treatment, we focus on elderly groups and high-risk groups. They will be our main targets of treatment. So we will reserve over half of the slots to give priority to these groups at designated clinics. We understand that some private hospitals and medical organizations may consider arranging designated outpatient clinics to treat patients with mild symptoms. So if need be, we can arrange for them to prescribe these oral medication as well. As for points to note and indications, the two professors will elaborate later. As mentioned by the Chief Executive, I'd like to give further information on the following. Last Wednesday, I said here that Queen Elizabeth Hospital will be gradually converted to a designated hospital for treating COVID patients. Starting from last Wednesday, we've arranged for ambulances to transfer patients to other hospitals. Starting from Wednesday to Saturday, the transfer of patients, the arrangement of A&E departments, and deployment of ambulances have more or less complete. And by Saturday, the ambulance services resumed to its normal condition. Now, if you dial for an ambulance, then only confirmed patients will be taken to the A&E department of QEH. For non-COVID patients or non-confirmed patients, if they call for an ambulance, they'll be sent to Kwong Wah Hospital. So in the past 2 days, attendances at A&E department of QEH remained at about 360 to 370 per day, close to its normal level. Now, at the A&E department, although it's still very busy, and some patients may have to wait, the situation is still difficult, but we have seen a marked improvement, and the congestion at the A&E department is much relieved. And with the arrangement of QEH, we can enhance the deployment of wards. Some patients that need respirators are now focused in certain wards of QEH. So that is to focus on patients and focus our care. I'm sure that can benefit our patients. We've always also arranged for experts from other clusters to provide support and treatment at QEH. I'm sure that will be effective. As I said, in other hospitals, now we have designated hospitals of a smaller scale, but they have more or less completed the conversion of dedicated treatment for COVID patients, such as the Tin Shui Wai Hospital, the North Lantau Hospital, Feng Yu King Hospital, and Rattanji hospitals. They have arranged that half of the beds are mainly for COVID patients. We'll continue with our conversion of wards and renovation works so that we can enhance our capacity to take care of COVID patients. I can report to you that last week we said that hopefully in the near future we can renovate some of our wards so that some general beds can 50% of these general wards can be for COVID patients. We're more or less completed. We have now 11,000 ward beds, mainly for COVID patients. We have about 22,000 general beds, so about 50% of our general beds are now for COVID patients. This is very important. It enhances our capacity to take care of patients. In different facilities of the hospital authority, we have about 10,000 confirmed COVID patients receiving treatment. Through our continuous conversion of wards, I think that will greatly reduce the time of waiting time of patients at A&E departments. We're beginning to see results. Yes, the situation is still difficult. Our E&E departments are congested. Patients still have to wait, but at its peak, we have 1700s, 1800s of patients waiting at A&E department, but now the number is reduced to about 800. So the situation is markedly improved, although it is not satisfactory, and there is still room for improvement, but we are gradually improving the situation. We'll continue to work hard to enhance our capability, and we can make available more beds to take care of confirmed patients. As mentioned by the Chief Executive, the number of patients is still high. We do need to enhance our caring capability, and therefore in North Lantau, in Asia World Expo in particular, with the supporting medical team from the mainland. Now we have done a lot. We have discussed with the experts. And when mainland medical teams are here, they can help us. We have had a lot of exchanges and discussions, and our view is that we should adopt a collaborative approach to serve patients at AWE. The increased manpower from the mainland will enhance our capability to take care of more patients. So our initial understanding and discussion in terms of treatment and caring approaches, whether we talk about clinical observations, use of medication, and use of treatment, we are very similar. But of course, when it comes to operation, we are from two different systems. It takes time for us to work together, but I'm sure with time, things will be fine. With more medical teams arriving in Hong Kong, we will further our work and enhance our exchange so that they can take part in our work and help to take care of patients. Professor Hui.
Thank you, Chief Executive. I will give some brief introduction on the two oral medication. Both of them could suppress the reproduction of the virus. They work best for mild symptoms, particularly within 5 days of onset of symptoms. Now, if, say, with oximeter, the reading is 94% of more, then this patient is suitable for taking the oral medication. And if someone is diagnosed, then the best is to use this medication as early as possible. So therefore, at the designated clinics, residential care homes, outreach medical teams could prescribe this medication to the home residents as soon as possible. And even at hospitals, we are administering the drug, but it has to be administered at an early stage. And, for those who are not suitable, they are the high-risk group, that is those age 70 or above, or others with chronic condition. The BMI is more than 38. That's those who are obese, or others who need renal dialysis, or those who are cancer patients and who need to take medication to suppress the immune system and so on. and then for those with lung and cardiovascular problems too. And then there's another group that is those who have not completed vaccination. Now, if the standard now is that you have to complete 2 doses of BioNTech for you to be considered having completed vaccination. If it's Sinovac, then you have to take 3 doses of Sinovac before you consider to have completed vaccination. If you haven't had all these doses, then you are also a high-risk group. And then the other is the suppressant for protein suppressant, and for people who are pregnant or who are breastfeeding, as long as they don't have any serious problems, they could take this medication, this Paxlovid. The usual side effect is diarrhea, slightly high blood pressure, or muscle pain. And for those with renal failure, then they have to be careful. If they have poor renal functions, they should not take this medication. And then there are others who have lung problems. They shouldn't take this medication too. And for children aged 12 or above, it's safe for them to be administered this drug. As I mentioned, if you have not completed vaccination, you're 70 years of age or above, even with those high-risk conditions mentioned, you could still take this medication. Now, they have done random sampling with placebos and around the world, and it's found that they could reduce the risk of hospitalization or death by some 90%. That's the Paxlovid. The next medication is the MSD medication. It is also to suppress the reproduction of virus. Now, it could affect the growth of fetus, so therefore pregnant women should not take it, or mothers breastfeeding should also not take this medication. And then it could affect the bones and the growth of bones and tendons, therefore, or cartilage rather. So it's only suitable for those aged 18 or above, because it affects bone growth. And then the side effect usually is some diarrhea, stomach ache, or abdomen pain, and so on. And then for patients with renal problems, they could still take this medication. So the contraindication is that if you are pregnant, you're breastfeeding, or you're under 18, then you shouldn't take this medication. Again, in the global study, this medication could reduce the risk of hospitalization by 30%. So that's just a brief introduction. Professor Hong will give you information about clinical experience. Thank you. Well, Professor Hui gave you some data about these 2 oral medications. But if I could add, for the Hospital Authority Experts Group, we've had frequent meetings to discuss this 2 medication and see how we could compile a guidelines. Now here we're talking about basically people with mild symptoms. That means the oximeter reading has to be, the blood oxygen level has to be 94% or above. And as Professor Hui explained earlier, the drug is administered, the more effective it is. And then it's also for high-risk groups who would have a high chance of complications, then the drug should be administered within 5 days of diagnosis or onset of symptoms. So who are the high-risk groups? For those aged 70 above, we would consider them as the high-risk group. And also, they have not completed their vaccination. Either they have not had any vaccines at all, or they have just had less 1 or 2 doses of Sinovac vaccine or 1 dose of BioNTech vaccine. And then these groups are considered to be not having completed the vaccination. Why do we classify it this way? Because we find that in the 5th wave, most of the severe cases involve the elderly who have not completed their vaccination. Some have not been vaccinated, some have had just 1 dose of biotech or 1 or 2 doses of Sinovac vaccine. And for those who take, for these people, usually they have various conditions. They had cancer and so on. And if they've had just 1 or 2 doses of BioNTech, we have still seen infection cases. And there's another group for those aged under 70 or below. Now, one of the conditions that they have not completed the vaccination, the criteria I just mentioned, that is, and also they have underlying condition. Maybe they have had transplants, or they have tumors. They are taking chemotherapy, or they have a cardiac or other pulmonary and liver issues. Now, for Paxlovid, Pfizer. So how do we choose between the 2 medications? First of all, Pfizer's Paxlovid, its medication has stronger efficacy. The advantage is that it can be administered to those aged 12 or above, or those with a weight of 40 kilograms or above. And then for pregnant women and breastfeeding patients, they could be administered with this drug. Now, if you could take oral medication, then you could use this drug. That's the advantage of it. The disadvantage is that there is relatively higher chance of drug-drug interaction, because for the protease, there is one component that is protease inhibitor. It could affect the CY3THTA liver enzyme, and so it could lead to more drug-drug interaction, such as for heart medication or antibiotics or blood thinner. So these drugs would be affected by Paxlovid. That includes also other blood cholesterol medication too. So if you take Paxlovid, you have to stop the other medication for 5 days. And also it will affect the liver enzyme level. Let's say if a patient has liver sclerosis or liver failure, then they should not take this Paxlovid. As for MSD molnupiravir, it can be administered to those aged 18 or above. But then for pregnant women and breastfeeding mothers, they should not take this drug. And then for people with liver or renal failure, they have to be careful taking this drug. Well, it's not a strong medication, but the advantage is that because this is in a form of capsule, so we could remove the capsule and it could be administered to the elderly, say, who are on feeding tubes. And also there's less drug-drug interaction. And then there's no effect on the liver enzyme level. So if a person does not have any liver problems, or the person is taking other drugs, then the impact is relatively less. Now, as Professor Hui and Dr. Ko mentioned, we are already administering these 2 drugs. And then for the elderly, especially for those who are diagnosed at the early stage of the infection, we've used the drug. We find that it works very well, where it is able to prevent the deterioration of the cases. But then, as I mentioned, there are high-risk groups. So, the key of this medication is that it has to be administered early. It can then prevent severe and death cases. And so far, this medication has worked rather well. So in future, how are we going to administer the drug? Now, at designated clinics of the hospital authority, even at private clinics and private hospitals, if they are prepared to treat COVID patients, at the outpatient clinic, then they could administer this oral medication. Thank you.
Q&A. Please raise your hands. And please also identify the organization represent and speak into the microphone we pass to you. Because we have quite a large turnout, so each journalist can only ask 2 questions and there can be no follow-up questions. Lady at the back. Good morning, TVB. Of Hong Kong, and how come they can have compulsory universal testing within a day? So is there anything we can learn from their practice? I'd like to know which hospitals will mainland medical teams be deployed to, and or will they just go to 1 or 2 hospitals? I'd like to know whether the level of antigens of a recovered patient, how do they compare with that of those that have received 1 or 2 doses of vaccines? Now, the questions on treatment, I'll defer to Dr. Ko or the 2 professors. Now, when Shenzhen or mainland cities spot any confirmed case, they will at a very early stage introduce CUT, compulsory universal treatment. They would even restrict the operation of enterprises and also shops. This has been adopted by the mainland in the past 2 years and have been effective. But whether that can be administered depends on the system of the place concerned, whether we have the resources. Now, delays. Many members of the public said they could not get their results within 48 hours even, while the standard should be 24 hours. So we have had a major comment on treatment. I'd like to say that for the medical teams arriving in Hong Kong now, this is at the request of the Hong Kong SL government. The central authorities have accepted this, and under the leadership of the National Health Commission, they have been organizing for medical teams to arrive at Hong Kong to join our treatment efforts. In late February, the Scene Council also approved this regulation. That is under the emergency regulations ordinance. We enacted a piece of regulation enacted for COVID-19, and the objective is to exempt some statutory requirements and applicable to personnel. And so we can make good use of resources from the central government to and that lays a very good foundation. So there is a sound legal basis to allow mainland medical personnel to help in Hong Kong. As regards the duration of stay in Hong Kong, now we've got the AWE Community Treatment Facility and North Nantou Hospital Infection Control Center. Now there are over 2,000 beds in total. We need thousands of medical personnel, but as said by Dr. Ko, we can adopt a collaborative approach. We can have Mainland and Hong Kong medical staff working together. So the central authorities have mobilized their teams to come to Hong Kong base our evaluation. So as I announced, the first batch of personnel 75 comprising doctors, nurses, paramedics, and supporting staff will arrive in Hong Kong. And within the same week, we have another 300 coming and more are to come. But I cannot pin down on a particular figure today. And as regards their participation, perhaps Dr. Ko can supplement. As the CEO mentioned, we will focus at the treatment at AWE with the medical Mainland team. We have several halls at AWE for community treatment facilities. Previously, manpower was tight. In the previous waves of outbreak and in the start of the fifth wave, patients were younger. They were able to take care of themselves. But now the patient profile is we have more elderly patients that need care. So we need more manpower to make good use of the place and also the resources. So we will focus on AWE with a collaborative approach. We will enhance the quality and quantity of care to patients with the help of the Mainland medical team. As for the protection offered by vaccines against Omicron and Delta, I understand that Professor Hui has previously explained, but he can elaborate now. Well, an infection of Omicron and or Delta could boost a very high level of antigens equivalent to 9 months. And then if you've been infected with Delta, you do not have any protection against Omicron. But the opposite is true. If you've got Omicron, then you've got protection against Delta as well.
The gentleman on the front row. I'm from Wenwei Po. For the Mainland medical teams, the mode of operation or the medication they use that may be different from that we have in Hong Kong. So how are you going to resolve that? And another question is on the oral medication. Now you have been administering such drugs. How many of such drugs have been administered? And you say you could reduce the number of severe and death cases, but then the death rate is still going up. So when can we start to see a downward trend of that cases? As for the respite centers for the elderly, now in the past you've been asking private hospitals and other groups to help. So how many private hospitals or medical groups have you enlisted? And is it the case that as long as you could find vacant premises, then you could be providing more respite centers? Well, Professor Dr. Ko and Professor Hui, and then we'll talk about our collaboration with the private hospitals. Now, on working with the Mainland medical teams in the past week, we've had detailed discussion with the experts who came here. Well, on clinical management, clinical observation, treatment, and care, there have been in-depth discussions. The treatment approach actually is very similar, put simply. That is whether there's need for intravenous injection, whether there's need for oxygen supply, and what sort of vital signs we need to monitor, and so on. Now we have referred to a body of international data and indicators. So in terms of clinical treatment, we believe there wouldn't be much of a problem because it's really very similar. On patient records and so on, well, as you know, we usually use English, and for colleagues from the Mainland, they usually use Chinese, but then this is something we have addressed too, because in the clinical system, we have included Chinese input. And also for the two teams, there have been no problem in terms of communication. And so we don't expect much of a problem. But of course, we have to be careful because there are teams coming from different sources, and there's a need for them to, to work properly. So, but in any case, so far we have done much in terms of preparation, and everything has gone well. And I'm quite sure they will be able to help our patients. You asked them how many courses have been administered. I learned from Dr. Ko that at their clinics and homes that they've already administered some 1,600 courses. Now, when would we start to see the drop in the number of death cases? But if we could administer such drugs, I'm sure it will help. But of course, apart from drug administration, boosting vaccination is important because many elderly have not yet been vaccinated. So the two go hand in hand. Now, in Queen Mary, we have administered drugs to about 300 patients, and we find that it's a molnupiravir, and 80% that there's no further deterioration. 20% have show signs of pneumonia. But in any case, we can find that with the use of drug, the effect is, the outcome is better. Now, for elderly respite centers, they play an important role in our triaging system. For elderly with mild symptoms, they could leave hospitals and go to the respite centers. Then we're able to put them under observation to prevent their mild symptoms from deteriorating. Now, we have put to use 2 respite centers converted from indoor sports center. One is at Choi Wan Road, the other is at the Shek Kip Mei Park. For both centers, the occupancy rate is high. That's why we keep trying to provide more such facilities. And we now have another 1,200 beds at the Kai Tak Cruise Terminal. You said we have many sports centers. There are 7 other indoor sports centers at Harbour Road, Siu Sai Wan, and so on. The last time when I had a video conference with private hospitals, we asked for help on 4 fronts. One of those is if they could take up the management of some of the respite centers, because there are still treatment and medical observation involved, so we need medical staff. And I understand the response is good. Now, I didn't check this morning, but I know at least 2 private hospitals are prepared to take up the management of these centers. Perhaps Professor Chen could tell you a bit more later. Now, so it seems that we would be able to resolve the problem of finding organizations or private hospitals to take up the management of these centers. But then there's one issue that's more difficult to resolve. That's the provision of carers. Now, for medical staff, of course, they will be monitoring the health condition of the elderly and then do a medical observation. But then some elderly patients need care, say they need to be fed or need to be bathed and so on. And so we are working very hard to recruit carers locally and from the mainland. So far, the carers we have recruited are not enough for us to launch all these respite centers we have in place. Even the beds are ready, but we need to have enough carers for the respite centers to serve their functions. Professor Chan, have you been in contact with private hospitals? Yes, if I may say a bit more. As the chief executive mentioned, we still have 7 respite centers in the pipeline, but as the chief executive mentioned, she talked to private hospitals. Some have indicated interest. 2 private hospitals are making preparations now, and hopefully within this week they could start 2 respite centers. there are other private hospitals trying to get more information to see if they could also take up such a role. For the number of indoor sports centers, we are still looking at that. We are assessing another 3 or 4 indoor sports centers to see if they're suitable for conversion. Because, as mentioned, for the elderly with mild symptoms but who need care, the respite centers would certainly play a role in relieving the pressure on hospitals. So we will therefore still push ahead with such plans. Now, for these respite centers or holding centers, we will also be providing Chinese medicine service. At the far end there, the jet wearing a gray mask. I'm from Phoenix TV. First question. We're still seeing a high number of confirmed cases every day. When you distribute COVID-19 medication to patients, is there any priority? And when patients are being given this medication, do they have a choice? And how much of the oral medication have you ordered? And with the supply of the oral medication, would it lead to any breakthrough in treatment? Now, in early 2020, when there was the first outbreak, there were robots to do disinfection and distribution medication on mainland. That's to prevent a cross-infection. Would you make reference to such an approach in Hong Kong? Well, I will invite the 2 professors to talk about the choice of between the 2 oral medication. Now, the SL government has helped the hospital authority to procure successfully the 2 oral medication. Now, how much have we ordered? I understand Professor Chen was asked the same question at a Legislative Council meeting earlier. But then there is a confidentiality agreement with the 2 pharmaceutical companies. We could not divulge the quantity of drugs for each batch arriving in Hong Kong. We could not divulge the price too. But as I said in the opening remarks, I mentioned that we have successfully procured a relatively sufficient quantity of the 2 oral medication. Now, in our fight against this epidemic, we are not short of money. We actually have to fight to buy the medication with others, and we managed to procure a relatively sufficient quantity of the oral medication. And then clinically, the 2 medication will be widely administered, because about 10 days or so ago, a research team of the Hong Kong University came to present their latest assessment to us, because at that time we focused on treating severe cases and on reducing the number of severe and death cases. At the time, the team told us there are 4 forms of intervention that could help to reduce the number of death cases. And among these 4 interventions, the most effective one is the application of this medication. So they have all the data. That's why, on the part of the SL government, we will definitely support the wide administration of these 2 oral medication. That's why we have procure what we consider to be a relatively sufficient quantity of the drugs. But of course, if there's still not enough, we could buy more. For the other 3 interventions, the first one is to substantially increase the number of beds for treating patients, and we are happy to see that the hospital authority managed to increase the number of beds for COVID patients to 10,000. There are now 10,000 patients receiving treatment. The second intervention is definitely vaccination. So that's why we have vaccination program targeting the elderly and young and children. And we are being more aggressive now to try to vaccinate the old and the young. So we must appeal to the public to support our effort in this respect. The 4th intervention, well, that is something we have to consider very carefully because it may not be as effective. That is to further tighten social distancing measures. But I'm sure the public will have strong views or concerns about that. That's why among the 4 interventions, the Hong Kong U team said if we could achieve 3 of them, that would be very good. And for the 4th intervention, we have to consider the mental condition, the mental health of the public. So the SL government has to be very careful if we are to further tighten social distancing measures. As you know, last Monday, in the light of the strong demands from many, we have allowed hair salons to reopen so that the public could still engage in certain normal activities. And that's the situation now. Professor, can people choose which drug to use?
You asked about the party groups. Well, Professor Hong, I already said that for those who are over 7 years old with high-risk factors, or if you have not completely vaccinated now, these are high-risk factors. Whether there is any option, well, it depends on drugs available to us. That's the critical conditions. Now, if aged between 12 and 18, of course, we will use Paxlovid. And if the patient is pregnant or is breastfeeding, then again, Paxlovid will be used. If the patient has a liver problem or is taking other medication with a drug interaction, then probably will choose molnupiravir because there is less drug interaction and with this drug, and it doesn't affect liver enzymes. And if the patient is using tube feeding, then molnupiravir is better because it can be administered this way. If the patient has a renal problem, then Paxlovid will be better. So it depends on the patient's situation, and these are the indications, and it's for the doctor to decide. Use of AI system. Different places have different technology to tackle COVID. It depends on the circumstances. In the past 4 or 5 years, Hong Kong has invested substantially in innovation technology. We've also attracted lots of personnel, and in the past 2 years, fight against COVID, we have widespread use of technology. We have a list. The startups and enterprises in Science Park have provided products in this fight against the COVID. We have just recirculated these product lists to departments and organizations for them to choose from. Now, I think we won an award in the Asia Pacific in the application of INT in the fight against the pandemic. We're doing quite well because INT can help to fight the epidemic and can also realize Hong Kong's vision to be an international INT hub. This lady in the middle.
Free Press. Hong Kong's death and infection rates has surpassed what London, New York experienced in the past 2 years, and images of body bags piling up in hospitals went viral. Will you and your government assume primary responsibility and admit that your administration has failed to take action last year when it had a chance? Will there be an inquiry as to what went wrong? And second questions, both Dr. Hui and Dr. Hong said that the oral medications for COVID-19 should be administered at the earlier stages of infection. However, with the number of daily infections far surpassing the number of quotas available at designated clinics, how will the government ensure that the medication can be distributed to those in need in time? Thank you.
Well, to answer your first question, throughout the more than 2 years of fighting the epidemic, the Hong Kong SAR government has put in all the necessary resources and efforts in order to keep Hong Kong people safe. And we did achieve that objective of keeping Hong Kong people safe until we were hard hit by the 5th wave arisen from a highly transmissible Omicron. And this highly transmissible Omicron has also hit other parts of the world. As you can see right now, especially in the Asia-Pacific region, we are still seeing a very high level of cases in many of the countries and places. And unfortunately, despite the past successes, Hong Kong on this occasion is no exception to this highly transmissible wave. And there's a lot of reason to that, which we have explained on previous occasion. But the most saddening part of it is vaccination. We have spent over 1 year to promote or encourage, to coerce people to take the jab. But unfortunately, the entire society, partly because of the low infection rate in the last year or so, and partly because of anxiety and worries and so on, that we have not achieved this high rate of vaccination, especially amongst the elderly, particularly betting. That could also include our capacity building in many, many aspects. So I would hope that the opportunity will come for us to review all these existing practices in order to enhance the safety of the people of Hong Kong. As far as the purchase of drugs, the actual procurement was of course done by the hospital authority. But the Hong Kong SL government has been facilitating and supporting the procurement by the hospital authority. And I am very grateful to the two drug companies for giving us their utmost support and cooperation, because I've been in personal touch with these two, the senior people in these two companies. And we managed to get one drug arrived in its totality in Hong Kong now, that is the MSD drug, and the other will start to come later today. So we have procured sufficient quantities of the drugs for wide application amongst people in need. And who are the people in need? The two professors has already explained to you. Thank you.
好，我哋問多最後一條。
Last two questions. The gentleman in the front.
I'm from RHK. For mainland medical teams coming to Hong Kong, what if there are medical incidents and how would you deal with that? Now, it's mentioned that if necessary, the government may consider further tightening social distancing measures. Now, there have been media reports about 1 person per table at restaurants. And what other social distancing measures are you considering? And under what condition would you roll out these measures? Thank you. First question. I have briefly talked about that. At the end of February, to make sure there is an adequate legal basis for the mainland to support our anti-epidemic method, the regulation has been enacted. That is the emergency situation exemption regulations are about COVID-19. So this regulation is to allow certain things or certain people to do certain things in the fight against the epidemic, and they won't be subject to the statutory requirements in Hong Kong. So for all the mainland medical teams, they will all be exempted in this manner. And the Chief Secretary of Administration, under authority delegated to him, has already granted exemption to mainland medical teams if they are in Hong Kong to give treatment, they would not be subject to statutory requirements such as the medical registration ordinance or nursing registration ordinance and so on, because it is impossible for us, of course, to ask these mainland medical personnel to make the relevant applications. But then, would that lead to any legal issues in the course of treatment? I understand in the past few days, the hospital authority discussed such issues with the with the mainland team that was here. So perhaps Dr. could tell you more about it. Now, I must stress that here we are receiving substantial support from the mainland. There are many medical institutions on the mainland, and all that who came are actually serving staff members in their own respective organizations. They have, left their posts to come to Hong Kong to help us. That shows that mainland compatriots care very much about us, and they are happy to come and help us out, just like what they did. They went to Wuhan to give support. So here now they are coming to Hong Kong to help us. Now, perhaps I should mention, with every battle against epidemic, there are many ways we can do it, and we have to consider these measures, and we have to learn from experience, and we have to have regard to the actual situation. And now for us, the priority is to reduce severe and death cases. That's why among the measures and policies we are adopting, we're focusing on reducing severe and death cases. We are enhancing our treatment capacity. We are increasing more beds, and we are more actively promoting vaccination to prevent infection. We are not considering further social distancing measures, because the current social distancing measures in place are already the toughest in 2 years. I have to consider whether the public would accept further measures, so we would not just casually roll out further social distancing measures. But I must make an appeal again to the public. This is not time for us to let down our guard yet. Maybe the trend, there is a plateau or even signs of a downward trend, but it's not yet time for us to let down our guard. Maybe we are suffering from epidemic fatigue, but I must ask people to be more patient, and please still observe our existing social distancing measures. Please avoid avoid gatherings and avoid going out, so that we could prevail over this wave of the epidemic sooner. Thank you. That's the end of the press conference. Oh, Dr. Tony Ko, please. In response to your question, in the past past week, we've had in-depth discussions with the mainland experts. Our consensus is that we will adopt a collaboration model in our operation. So in terms of clinical management and handling, we will still be using the existing practice. Well, tomorrow we have the Executive Council meeting, as I mentioned earlier. So for the daily anti-epidemic press conference, it won't be held tomorrow. On Wednesday, we'll be meeting with you again. And then we will update you on another important aspect of our anti-epidemic effort. Thank you. So we'll see you again at 11 a.m. on Wednesday.